Okay. Right. Hello, everyone, and welcome to this expert talk. My name is Einav Avni. I am an energy healer and an alignment coach. With me today, we have Rachel Clark. Rachel, so lovely to have you here.
Thank you for having me.
Wonderful. So let's get started and maybe tell us a little bit about who you are, what you do.
So just so you know, I live near Toronto in Canada. So it's early afternoon here. Hopefully the sun's going to stay out so you can see me the whole time. I teach Reiki and intuitive healing. I've been teaching Reiki for almost 2 years now, but I've been in the Reiki industry for over 10 years. A couple of years ago, after becoming, or I guess 4 years ago now, after becoming a Reiki master during COVID, I just got the nudge to start teaching and started that journey. Took about a year. And it's been going strong ever since. I added in teaching intuitive healing, which is basically, I say intuitive because saying that you're a psychic medium scares people sometimes. But intuitive healing is medical intuition. Part of what we do in Elemental Reiki is we stack modalities. Reiki is one of the modalities, and then medical intuition is basically using psychic tools and going into the physical body and healing specific areas. It can be a physical trauma, emotional trauma, or spiritual trauma, which would include past life healing as well. And so when you're doing a Reiki treatment, you can be working on somebody's head and healing, like, you know, we all have those busy minds from our days and, and worries, and creating that calm, peaceful space. And then psychically, you're working on, say, inflammation in the knee. So you can be in two different places at the same time. It's a very, very powerful tool. And I love doing it. Absolutely love doing it.
It sounds amazing. And I'm very curious. I mean, of course, I have heard of Reiki. I had one remote session once, but I'm very curious about the intuitive healing, I guess, personally, more specifically, because that sounds like wow. And you say you can teach it, then it's like double wow.
Because the same as you, what we want people to do is to look at alternatives that don't have side effects. Like a lot of medication that we use. I mean, I have Hashimoto's, so for 26 years now, and I would love to not take the medication, and I work on my thyroid, but I've had it for a long time. But using using the medical intuition, you're pulling in lots of guides to help work on those specific areas as well. And being able to give it to myself and not have to go somewhere else is a gift. So I want other people to know how to do it so that they can also do it themselves.
Amazing. Let's start from the beginning. We're talking about healing with Reiki first. So, as you said, some people don't know what Reiki is. What is it? What is it? Let's go straight there.
So very simply, Reiki, it's part of energy work, the same as what you do. That modality, that huge, huge field. And a lot of people believe that Reiki is a Japanese tool, but that's not the case. It is a very ancient healing technique, and was rediscovered by Master Usui in the early or late 1800s in Japan, and that's why some of the symbols and the names have their Japanese names, because he was Japanese. So Reiki is channeled energy that comes from the highest of good. So in your hierarchy of angels, you have your ancestors, spirit guides, psychic guides, and then you have the archangels and gods and deities. So it's channeled from them through the Reiki healer into the practitioner. And it's directed out of our hands, but Reiki itself is an intuitive healing modality. So the Reiki goes where it's needed. So I could have my hands on over your heart, but it's your ankles, for example, that need most of the Reiki. So while you'll be receiving Reiki in your heart, it's moving through your body to the area that needs it the most all the time. And what it does is it promotes the body's ability to heal itself. It's really that simple. There's no side effects with it. You'll feel good. You might be sleepy. It also is has the ability to detox the body's organs up to 15% at each treatment. You usually sleep better. It helps release suppressed emotions, those trapped emotions that we were talking about earlier. Reduces inflammation, anxiety, depression, panic, all of those emotional disorders as well. You can alleviate those. And some people will feel a difference in one treatment, and others may need multiple treatments to feel a bigger impact. It always depends on how chronic the issue is. It's also actually in England specifically. It's one of the ones that I was looking up. Reiki is used a lot in cancer centers now to help alleviate the symptoms of chemotherapy. And so they'll actually have Reiki practitioners come into the cancer centers. And I think England may have been one of the places that actually started this, but it's spread all over the world. There's lots of countries that have just specifically for cancer, have Reiki practitioners come in and work with the patients to help the horrible side effects of chemotherapy. But it also helps work with the chemotherapy to yield a better outcome as well.
Yeah. Sounds really incredible. And I know, again, from the work that I do, that, you know, when I work with someone to release trapped emotions or imbalances in the body, I actually set the intention for the, you know, trapped emotions and all of that to leave or to do whatever it is, depending on what I'm finding. Is that kind of what you do? So when you do the Reiki, do you set intentions or how does that work?
So for Reiki, it doesn't actually matter what is going on in my own mind or my own emotions. Sorry. Because it's channeled and because it comes from the highest of good, it just literally flows through me. So I can't impact the good that the Reiki does. I can't stop it or make it have less impact. When it comes to the intuitive healing, then I'm setting an intention. So that's where I start stacking the modalities together to yield the best outcome. Intentions of like directing where I want that psychic energy to go for specific healing. And if it's emotional healing, how I want to remove it and elevate it. With Reiki, we don't take the energy that's unwanted and move it somewhere else. We don't displace it. It's kind of like passing the buck. Which is exactly what you're doing as well when you're releasing those trapped emotions, is we elevate them and raise the vibration and move it away. So it's getting dealt with, that unwanted energy, at the same time as the person is dealing with it as well.
Mm-hmm. And so who would normally seek Reiki? I mean, I imagine it can be for anyone, but who do you mostly see?
Oh, well, my practice has actually changed quite a bit over the years. I have 3 sons. My youngest is 21 and my eldest is 25. So I only have one at home now. But when they were all at home, a lot of my clients were in that young adult age, and a lot going through severe emotional traumas, like some had suffered sexual abuse, physical abuse, were suicidal. And so for a few years, that was the bulk of my clients, of my work, was helping those people elevate. And they're all doing amazing now too, which is really wonderful. I've worked with women with fertility issues as well. Currently now I work with more students, so it's much more varied. I don't have a particular niche when it comes to Reiki, because Reiki is suitable for everybody. It doesn't matter what the issue is. Everybody can use it. There's no harm. It doesn't affect your medication. Yeah,
Right.
big range.
Yeah, and that's yeah, that's really interesting. So if someone comes, so say with chronic conditions, how much, how often, what kind of, what would that look like?
So usually in the first session, I can assess myself and also listening to messages that come in while I'm giving Reiki, how many sessions the person would need to get relief and the frequency. So if it's something, if someone's going through cancer therapy, it's typically 2 to 3 times a week, depending on the type of cancer staging and what they're doing to, if they're doing any other energy work, or they're just using allopathic methods to heal. If it's something like arthritis, for example, like rheumatoid arthritis, you might spread the appointments out. Like it could be once a month, it could be once every 2 weeks. It's really very much case by case, because it always does depend on what else the individual is doing to progress their healing, right? This is, I'm sure, the same for your clients as well, is what they're doing to get rid of those things or habits or mindsets that had created blockages in the past. If they're repeating those patterns, then they're going to keep going back to the beginning. And if they're progressing really quickly, then it could be a very short duration.
Yeah. And so in your sessions, are you you're bringing both Reiki and the intuitive healing at the same time, or?
All the time, every time.
Yeah.
Yeah, every time.
So tell me a little bit, what would that look like? So sometimes, people, especially if they have unexplained medical conditions, they might come in and think, generally speaking, it's a stomach ache, but then you, with the intuitive healing, you would see that actually,
It might be something else, yeah.
yeah. So would you?
So I'm not a doctor, so I can't diagnose anything specifically, even if I hear exactly what it is. But which I've had happen. For an example, I had a client that um, had, she was had hypothyroid, not Hashimoto's, but so a low thyroid. But she also had a parathyroid tumor, which the parathyroid gland, as you know, it's really tiny, and it's not something that's always checked. And usually it would be, there would be indications in her calcium, but there wasn't yet showing up in her blood. I guess it hadn't been long enough. But in our first session, I had picked it up, and she was going to have follow up with her endocrinologist. And I said, just ask them to do the test. Just say you have, you're feeling something in your throat, which she was, and ask them to do a test, ask them to scan it. You had to take control of your healing with your medical doctor. And she went in and she had a very large tumor on her parathyroid gland, which I think it was removed 6 weeks later. And a huge increase in her energy, even her, she was getting severely depressed, all from these glands being imbalanced. So, but I couldn't say this is the problem, like this is what's going on. I can say this is the area that you should ask your doctor to focus on and do your own research so that you can see if the symptoms match what's happening.
Yeah, it's more challenging when you can't diagnose, but yeah, trying to to encourage people to do.
And you can't walk into your doctor and say, I had Reiki and she heard a message that there was a tumor on my parathyroid gland and you should look at, like, the doctor's not gonna follow that. But directing them to go, this is the area, just go look, do some research and see what imbalances are there. And if that matches, then investigate it. I mean, sometimes people don't listen. I can say you have a dark mass on your lungs and you might want to go and get that checked. And are you having symptoms? And people don't do anything about it. So it just depends on the person.
Yeah. I was yeah, I was going to ask about the messages. So you say that so are you saying that anyone that does Reiki is able to communicate with higher things, higher beings?
Yes, because Reiki is channeled from higher beings, they're the ones that pass on the messages. I will say not all people that give Reiki are very skilled at the messages, or they won't pass them on. Even a Reiki practitioner can be fearful of, they're not sure what they're hearing, so they don't pass the messages on. It just depends on the individual. I guess I just embraced it a little bit more.
Yeah. So what kind of messages are there? Is it like really, a little bit to the left, a little bit to the right, or is it more
They're
more
they're
mysterious than that?
they can be very direct depending on the person, but they're also very gentle and kind at the same time. Like the intention is to be as helpful as possible. And even if I pass on a message and the person does act on it, it's to their benefit to
Mm.
do something. If it's a message about healing, my profession beforehand, I was a holistic nutritionist. I was always like seeking, like even in university, I studied psychology and fine arts, and I did a human anatomy course because I was just fascinated with how the body works. And that is maybe why I do receive a lot of medical intuition messages, is because I have that background. And so I can say this, it's this organ is doing this, or this is the area, like more specific than some people. Because your background, as you were saying, you were previously a coach, but you're using those tools now. And so everything that we've done up until this point is all gets put together so that we can provide the best healing, right?
Yeah, absolutely. But would you sometimes get messages like, go and make up with your, parent, or, yeah, stop eating tomatoes, or, you know,
Yeah, yeah, they can be on any topic. I mean, I've had messages saying to people, you're getting a letter. I don't know what the letter contains, but there's an important letter coming. And then messages on where somebody's, cutting out toxic family members, and they're really stressing that, this relationship is over. I'm never going to have a relationship with these family. My children won't have a relationship with them. But my message is, I see you sitting at a picnic table in a public place, having a warm conversation. When that happens is up to you. There's steps that are going to, have to take place for you to get there, but it will work out in time. It can literally be anything, or I see you with suitcases, you're taking a trip. Could be anything.
right, right. That is always fascinating for me. And yeah, I mean, I was listening to this book by Caroline Myss, I think her name is.
Mhm.
And the book is why people don't heal and how they can. And there she's telling a little bit about her experience as an intuitive medium.
Mhm.
And she said that it was very interesting for her that at the beginning, when she finally understood that this is what it was that she was doing, she said she would get someone with, for example, say headaches, and the headaches would be the topic, but then she would have three different people with three different reasons for the headaches. So
Mhm.
it wouldn't be like something that she can say, every headache, this is the root cause of the headache, is actually had very many different causes. And I was wondering if this is also your experience.
Absolutely. I've had a lot of clients that have had thyroid problems, because I have one, so I'm obviously pulling them in.
Mm,
And every single one of them, the management of it, how they discovered it, how they're currently treating it, how their energy level, all the other symptoms were different in every single person, which kind of reinforced there isn't a standard of care for anything, because
mm,
we're all individual and how we react to it is different. One person had severe joint pain and inflammation to the point where like they couldn't move their hands, and no other symptoms other than the thyroid. And then the other person was, which is similar to me, is the losing the eyebrows. Half of the eyebrows miss when you have Hashimoto's. They just don't grow. And it's severely dry skin. Like it didn't matter what she did, she just couldn't keep it hydrated. So it can be so vastly varied that everything needs to be more individual for sure.
And I can't remember, did we say that we're going to do a demo of some sort, or?
Yes, I would love to do a demo.
Nice.
If everybody's open to it. The one thing with Reiki is I need consent. I need your consent to give you Reiki. That's the one ask. With psychic work, you don't need consent, but for Reiki, you need permission.
Okay, so for those watching live, just gives us a thumbs
You
up.
can do a nod or a thumb up that you're good with it.
Okay,
amazing. Okay, so all you need to do.
Just want to ask, so how would that impact the people watching the replay? Would that be, do we need consent from them, or would that be?
So all they have to do when they're watching the replay is say that they consent to receiving Reiki when it comes up, and they should receive the Reiki that's been recorded.
Okay, wonderful.
So all you need to do is be really comfortable and relaxed. Just put your hands palms down, like on the top of your lap, and just lean back into your chair and close your eyes. I am going to just take a minute. I usually use a pillow for it's my surrogate. This becomes everybody. And when I do give a Reiki treatment, I make different noises. I might blow, whistle. I will definitely burp. So I'm going to apologize in advance for any of that. And just take a few breaths in through your nose and out through your mouth while I place the Reiki symbols. So Reiki will start at your crown. You might start feeling a warm blanket just enveloping your body. And the energy will pour down from your crown, right down through your body to your feet. And that quickly clears the channel right down to earth. And then we move down to the third eye. You might feel tingling just between your eyebrows, above the bridge of your nose. This is the area of your own intuition. You might also receive some messages. And then we move down to the throat, pulling the energy still from your crown all the way down to your throat. And then moving down to your heart. You might start to feel it radiating out to your arms, feeling your chest getting warmer. And then down to your solar plexus and your abdomen. You might feel an urge just to wiggle a little bit in your chair and get the energy moving down your legs. Move down to your sacrum. And now I'm going to start pulling it down to your knees and your feet. And all of the unwanted energy will leave your feet and return into earth. And you can just take another really big breath in through your nose and then slowly let it out through your mouth. And then just slowly blink your eyes open when you're ready.
I went so deep.
Mhm. It's much nicer just to drift off to sleep afterwards.
Okay, yeah, well, not long from now. Thank you for that. That was very relaxing. Very.
Mhm. Did you feel it moving down your body?
I did. I felt some tingling, kind of,
Mhm.
as we were going down the body, and then I don't know where I went after that. But I'm curious. Have you ever done anything, or have you ever done a session on someone that surprised you?
Oh, all the time. I mean, if sometimes I get nudges before I meet with a client, sometimes they don't tell me why they're coming to see me. Usually they do, but sometimes they don't. And so I'll get nudges beforehand. But I had a client, she just was feeling like a little stuck in her life and booked a session. And for some reason it got canceled. And we booked maybe a week later. And it turns out her partner had decided to leave, like in the middle of the night kind of thing. And so I had been getting nudges that there was a separation happening, even though that wasn't the conversation I had with her, but all of these things had happened in between. And so there was a lot of grieving going on, even though she was feeling it very physically, but she needed to grieve. And so I don't go in with a plan unless somebody's booked multiple sessions for a very specific reason, but it can change.
Mm. Very interesting. Well, Rachel, thank you so much for everything, for the information, for sharing, for the demo. I am going to stop the recording in a minute, and of course, all of your information and stuff will be down at the chat wherever people are finding this conversation. And yes, thank you so much.
Thank you.